There we go. Okay. Hello. Apologies for the delay, but welcome everyone for joining us today live with Dr. Sophia Yen. She is the CEO and co-founder of Pandia Health. So last week was the election. I know a lot of you were probably stressed. I definitely was, but it's very important to note that there are changes being made with the Supreme Court and the Senate that we definitely need to discuss. And before we get started, don't forget to sign up for your free delivery of birth control. I actually got mine yesterday. Very exciting. Yeah, I was so happy. You get candy, lots of fun things. And you can also sign up for an online doctor's consult if you live in California, Florida, Texas, Arizona, or Wyoming. And with that being said, let's just get started. Great. Okay, so let's just jump into the first question. So, what is SCOTUS? What does that mean? Can you give us a little explanation of that?
It's important to know the lingo. So SCOTUS stands for Supreme Court of the United States. And conversely, there's POTUS, President of the United States. There's FLOTUS, First Lady of the United States. And then someday, hopefully, there'll be First Man or First Gentleman of the United States. But SCOTUS is the Supreme Court of the United States, and it is the ultimate court, the ultimate final saying about laws.
Cool. Sadly, I did not know what that was until recently. I did not know what that abbreviation meant, which is really embarrassing. So I'm glad we cleared that up.
It's not embarrassing. It's some people are really political and some people are not. And I think I probably learned it, only in the past year or two. And I'm like double or triple your age, so it's fine.
Thank you. So the next question going off of that is, who is currently in the Supreme Court of the United States?
So there are 9 members of the Supreme Court of the United States. There was a vacancy, unfortunately, because of Ruth Bader Ginsburg. I like to call her Notorious RBG, who was a strong advocate for women's rights. And if you haven't seen both the movies, there's one that's more, I feel, Disney-like, and then there's a documentary, both of which are really good. You should absolutely watch them. Unfortunately, this Republican-controlled Senate and Republican president shoved through the nomination of what I feel was an underqualified person and just an insult to Notorious RBG's legacy. A woman, good news woman, but bad news, just doesn't uphold the same values, has been known to be against birth control, has been known to be against a woman deciding what happens in her own uterus. And it just kind of cuts me to the core when women don't support women.
Yeah. Yeah, I really couldn't have said it better. So I know it's really unfortunate, but I'm really hoping that, as you mentioned, we just keep fighting and just keep fighting for our own rights. And yeah, and just hope and pray that things go okay in the end. So similar question, how many Supreme Court justices are Republican and Democrat? If you don't know the answer to that, that's okay.
Yeah. So luckily you guys prepared me and I Googled, but the justices are not supposed to be partisan. The justices are appointed for life so that they can make decisions and not be swayed by the public. But the reality is they absolutely are swayed by the public. Justice Roberts has been known to look at what is the legacy I'm going to leave? And do I want to be known as a justice who struck down the Affordable Care Act, which is one of the greatest things that has happened in a long time in this country, allowing millions to get insurance that didn't have it before? Am I the judge that wants to be known for striking Roe v. Wade, which is so important for women's right to self-determination? And those of us with uteri, what happens in our bodies? And are we just vessels for reproduction and subject to our rapist? Or are we allowed to decide what happens in our body and not have to carry something to term that we don't want to carry to term for 9 months? So know that the Supreme Court is subject to peer pressure. So if you protest, if you call, write letters or whatever, I think that definitely, can have an effect. But if you want to technically look at it, 3 of the justices were appointed by a Democratic president, and 6 of them were appointed by a Republican president, and they seem to follow those lines with conservative or are they liberal with respect to guns, with respect to rights, civil rights, women's rights, reproductive rights, voting rights, corporation versus individual. And so the conservative is all about the corporation. So maybe remember C and C. And then the liberal is more about, I always say the Democrats are about you and the Republicans about corporations. Because oftentimes you'll hear that, Democrats, they just want to tax the rich and the wealthy. And in America, we all hope to be rich and wealthy someday. So we don't want to be taxed to death. I say that we should pay our fair share, right? That the secretary of Warren Buffett shouldn't pay 30% of her income towards healthcare when he pays 1%. And Warren Buffett agrees. But there are other CEOs like Walmart, which is one of the richest companies in this country, which has maybe the top 5 richest people in the world or in this country, but yet they purposely underemploy their employees so that they are the number one company of which people are on the government insurance, because they purposely will employ people for 39 hours instead of 40 hours so that they're not full time. And so then they even give them pieces of paper. This is how you apply for state Medicaid insurance. And it's like, you make so much money. Why are we as taxpayers sucking up this cost? Like, you could pay for it and you should.
Yeah, no, that's a really good point. I noticed that if my birth control wasn't covered by insurance, it would be $400 every month, which is absurd. Or maybe it's every 3 months. Regardless, it's a lot of money.
Yeah.
And you don't even think about it now with insurance. Like, you just go and you get it. Sometimes there's a small copay, but $400 is like, I wouldn't be able to afford that. So yeah,
it's been estimated that women overall in the United States could have possibly saved $1 billion a year. And on average, maybe $400 a year, but it depends on, which form of birth control, what type of pill that you're exactly on. But women are spending far more out of pocket before the Affordable Care Act. So everybody should know, and I'd love to query a bunch of women on insurance right now. If you have insurance, it should be no copay, no deductible, aka free. And if not, then there are some exceptions, which is religious employers. And some of them that I always forget are like religious hospitals or religious educational institutions. So like Georgetown or Santa Clara University would never, based on their names, would I know that they were Jesuit? No, I would have no idea. Right. But because of that, they are exempt. And then if you have a strong moral conviction, you can also get exempt. Though I have an argument against that, which is I don't believe that corporations have souls. Corporations aren't going to hell and they don't go to church. So they shouldn't have a religion, and the corporation should provide it. And then you decide whether or not to utilize it based on your religion. And so to me, America was founded on freedom of religion, and we shouldn't push one religion over the other. And even within the same religion, you can have differing viewpoints on birth control, abortion, and other things. And so if you can't even agree amongst your religion, how can you push one view, over the other? But regardless, my body, my choice, your body, your choice, my body, my religion, your body, your religion, but don't take my right to prevent unplanned pregnancies.
Yes, no, I totally agree. I think it's just really interesting, especially when men like to comment and it's like they cannot have a baby. And so it's, of course, everyone has the right to their own opinion, but I do find it very interesting when they care so much about that, but not necessarily about other things.
The states that have the most restrictive abortion and reproductive rights laws are also the states that provide the least amount of support once the baby is born, because the liberals believe in women, infant, and children WIC funding for food and for clothing and for childcare. And the conservative side is like, once it's born, you're on your own. I just want to give a shout out to Dr. Donna White-Carey, an amazing physician out there in the community in Oakland. And she's also First Lady of True Vine Ministry, which I just love. And she is a strong supporter of reproductive rights. And then seeing 3 of our patient care advisors on board, just love all this participation. Feel free to throw down any questions, but loving it.
Feel free to comment anything. I'm just asking questions that I had, but seriously, like any questions are welcome. Yeah, so you kind of just answered how the Supreme Court is associated with birth control. So the next question is the race in the Senate. So how does that necessarily relate to reproductive health and reproductive rights?
So as I mentioned, the Supreme Court right now is heavily weighted 6-3 on the conservative side. And the last appointee was specifically chosen because she would be known to reverse the Affordable Care Act. And so the Affordable Care Act allows birth control with no copay, no deductible, which has been huge and resulted in decreased pregnancies, decreased abortions because decreased pregnancies, unplanned pregnancies. And so we need balance in the Supreme Court. So many of our rights are going to be absolutely destroyed with this 6-3 conservative majority. And so right now the Democrats are looking at, there's 100 people in the Senate and there's 50 Republicans, 48 Democrats. And there are 2 seats that are going for a runoff on January 5th for Georgia. And it's 2 Republicans versus 2 Democrats. What I like about one of the Democrats is he's a reverend. He has a PhD and his Baptist minister of Martin Luther King's congregation. I was like, oh, so much coolness here.
Yes.
And then I was lucky to be on a Zoom call with him and 60 other people. And I asked, where do you stand on birth control and comprehensive sex ed? And a woman's right to decide. And he says, I absolutely believe in a woman's right to decide what happens in her body, that the examination room is already crowded enough with the physician and the woman. You don't need a government or a senator in that room with her. And as I say, no gyneticians, hashtag no gyneticians, no politicians who think they are gynecologists, who think they are doctors. But again, it's about freedom of religion. And so I respect that a religious man respects freedom of religion and respects women's rights. And even cooler for Dr. Carey, if you're still on, is we both trained in adolescent medicine. So we love adolescents and young adults. And he was a teen peer health counselor and worked for the Department of Public Health for Georgia and consulted on, how to counsel youth on birth control, abstinence plus, as we like to call it. So not just abstinence only, but abstinence plus all your options. And I actually preach what I call born again abstinence. Just because you had sex doesn't mean you got to have it again. And in any heterosexual encounter, 30% of those with a uterus don't have an orgasm. And if you're not getting yours, why risk pregnancy or STIs? Do other things like, oral sex or mutual masturbation or better communication. Because if you're not getting yours, don't risk STIs or pregnancy.
Yeah, I love that. And I love the born again abstinence. I've never heard that term, but that's so smart. And it's so true. I feel like a lot of women, especially in college, or really any time when they start to become sexually active, they feel like, okay, well, I've done it once now, I can just I have to do it again. And if that's your lifestyle, amazing, go for it. But exactly, if it's not making you happy, if you're not having your own sexual pleasure, then what's the point? Especially with the risk of pregnancy. I love that. And I'm definitely going to use that term from now on. Kind of just like bringing it all around. Actually, I have one more question before we even get to that. So why do you think that schools, or I guess more on the conservative side of things, they're not super for sex education in schools or comprehensive sex education, but then they're also not for birth control and abortion? I'm just curious, like, what your thoughts are on there, because don't those things, wouldn't you think more sex education would help those things? I'm just very curious.
Yeah. So were you saying at the political level or were you saying at the schools?
At the political level.
Okay. Because I was going to say that when they've polled parents, 80% of them want comprehensive sex ed. And they don't want abstinence only. They want abstinence plus, which is plus all the other options. And California, being one of the most liberal states, just recently mandated sex ed. Before, they said, if you have sex ed, it has to be medically accurate and age appropriate, but we leave it to each school district. And there's something like 250 school districts in California. And you can imagine the conservative school district will be like, we're not going to teach it. And then the liberal school district, they don't need it because, well, they don't need it as much as the conservative one because the parent will teach the kid, right? Or they'll allow their kid access. The beautiful thing of the internet, but you can put up screens that could block it, is it allows you the ability to get comprehensive sex ed, hopefully from enthusiastic, medically accurate sources. My favorite sources are bedsider.org is a great source for birth control information. Power to Decide is also a flavor of that company. It used to be the National Campaign to Prevent Teen Pregnancy. So they have a lot of cool information. Advocates for Youth has a lot of good sex ed. And then Pandia Health, anything about the birth control pill, patch, ring. We are absolutely here for you to educate on that. So, but yes, it is absolutely a contradiction that the same people that are anti-abortion are anti-birth control, because the best way to prevent abortion is to prevent unplanned pregnancy. And by that, you provide birth control. And the best way, again, to prevent unplanned pregnancy and abortion is comprehensive sex ed. And the born again abstinence I use to exemplify that, you know, if you're not getting yours, then you need to better communicate. And so a really good sex ed liberal program in California called, I think it's Health Connected. Love them. They're the ones that gave me my signature condom bag, which, there we go.
Signature I have one of those bag. Too. Yay! Oh, that's amazing.
The signature condom bag.
I love that. I was an RA when I was in college, and so we got one of those too to just keep outside of our door. Yeah, it was the best.
So they have a curriculum that talks about consent. And so for anybody who's teaching sex ed out there, make sure you know about the T video, which I think is great. Do you know about the T video?
Love it. Mm-hmm.
Yeah. And so just for those who haven't seen it, it's I'm into all this effort to make this tea. What, you're not going to drink this tea? You would never force somebody to drink a cup of tea, even though you went through all this effort. And it's like, well, you said you wanted tea last week, so you have to have tea this week again. And again, it's the born again abstinence. Just because you had tea last week doesn't mean you need to have it again. And then if the person passed out, you do not force tea on that person.
Mm-hmm. Yeah. It's very true. It's so simple. You know, you'd think that it's more...
it's about respect.
This happens less common, but exactly. So pretty much going off of that, what can we do? What are some things I know you mentioned just doing? Well, first of all, in Georgia, getting people to vote in the next election on January.
Call, text, Instagram, direct message. If you know any 17-year-olds are going to turn 18 before January 5th, get them to register. But it's really educating people that this race is critical for our Supreme Court, and it's for balance. 3 to 6 is not balanced. And if you believe in healthcare, if you believe in equality, you believe in racial justice, any kind of liberal values, then we need to get these 2 seats. And the other side will try to scare people that it's socialism. But if socialism is Obamacare and Affordable Care Act, I'm all for it.
Mm-hmm. Yeah, I agree. It's funny. I think in the U.S., socialism is very different than how it's considered in other countries. I've heard that the U.S. is one of, I think, 2 or 3 countries that doesn't give paid maternity leave, which is absurd. And that should be totally something that we get. So, yeah.
Maternity and paternity leave to make it equal, because, you know, one random tip, as long as we're on, is I made sure as long as I did input breastfeeding, that my husband did output diapers, to be fair, so that I wouldn't have to do it all and that we would be 50-50 from the start.
Mm-hmm. I love that. Yeah. And we should totally implement that. I think, like you mentioned, as women, I think we tend to be very timid in those situations, and we feel bad for asking. I mean, you see the things about women who are in politics on Fox News saying how women are barking at their opponents just for speaking their mind. And that's so not true. It's painted in such a bad light. but it doesn't have to be that way. Yeah, that's awesome. And the last question that I have is, can your birth control expire? So I had this question for sure. I was thinking like, oh my God, should I just get an IUD because then it's in for a bunch of years and I don't have to worry about it. But at the same time, I really enjoy being on birth control. So yeah, how can we move forward for that if, something does happen in the Supreme Court?
I would say that if you're considering an IUD or implant, that you run, don't walk to your doctor's office because it may be totally booked for the next 2 to 3 months. Given COVID, a lot of physicians have decreased their in-office, but just know that it is safe if you go in right now. Like at Stanford, the infectivity rate is 1/10 of the population. So the prevalence in the population was 3%. The prevalence at Stanford, when we tested all the employees, was 0.3%. So if you're going into an academic clinic or even a community clinic, assuming they're reputable, they know how to contain infection and you'll be okay to go in. But know that it may be difficult, and know that if you're thinking about the implant or IUD, now is the time to do it before they potentially reverse the Affordable Care Act in January or February. The question there is that I think we should make it clear to insurance companies and elected officials that I like to say, it's a question if you like to swing positive or negative. The positive is it's fiscally smart and morally right to cover birth control. The negative is it's fiscally wrong and stupid and morally wrong not to cover birth control. But the fiscal part is important because insurance is all about money and profit. And so for every dollar an insurance spends on birth control, they save $3 to $7 on healthcare costs, because birth control is like $15 a pack of pills for most pills versus a vaginal delivery, $10,000, C-section, $40,000. And that's not including pre and postnatal care and well-child visit. And certainly if you're an evil insurance company that doesn't cover pre and postnatal care and well-child visit and ultrasound and delivery, then okay, it's cheaper not to cover birth control. But if you do cover this part, then you should cover that part.
Gotcha. Yeah, no, that totally makes sense. And I like that, the fiscally smart and morally right decision. I'm going to remember that. So it looks like we have a question from Dr. Carey. She asked, what's happening with teen pregnancy currently? Going up, going down? And I'm curious about this too. I wouldn't know.
Yeah, so being an adolescent medicine specialist, I'm very proud that Pandia Health is the only women-founded, women-led, doctor-led company in birth control delivery, and probably the only academic physician-led company in birth control delivery. So I am passionate about adolescents and young adults and preventing unplanned pregnancy. So the latest statistics show that the teen pregnancy rate is going down. And the reason why is that more people are going for the long-acting reversible contraceptives. And then the other part on the non-teenager, but like the 20-something, it's, I think, the Affordable Care Act and giving people access to birth control, because they've shown that when they have to pay out of pocket, women have to spend 30 to 60% more out of pocket for healthcare costs and from birth control. But when you cover that, then they're more likely to use it. If you don't cover it, then some women have like tried using it periodically, or, trying to save their pills or, stuff like that, as opposed to using it consistently, which is the most effective way for birth control. So the good news is that teenage pregnancy rates are going down, but we don't know what will happen if you take away the Affordable Care Act or if you take away coverage of it. And we don't know as more conservatives become in power. So unfortunately, this past election, we were hoping for a liberal wave, and the state governments control sex ed. The state governments control other kind of access laws, and Title 10, whether they take it from the government, Title 10 is money to cover family planning. And so it's really important that you check with all of the people you vote for, what are their values on birth control? What are their values on comprehensive sex ed? What are their values on covering birth control with no copay, no deductible? And then for all of us who can't vote in Georgia, we can donate, but we can call, we can text, we can email, and we can pray as well.
Yeah, text all of my Georgia friends for sure. Phone banking isn't so bad either. I did it for Joe Biden. I thought it was going to be terrible. It was not bad. And I would like
Yay.
to say it made a difference because Wisconsin went blue. So I love that. But yeah, no, that is very true. And I had another question actually, kind of unrelated to SCOTUS, but it just reminded me. So with birth control, I know you mentioned that it's important to take it regularly, of course. And you mentioned like, people say to stock up, like, okay, maybe I'm not having sex right now, so I just won't take my birth control. What are kind of the consequences that come along with that, like not taking it regularly? Why is it so important to do it on such a consistent basis?
Yeah, it's just that for the birth control pill, patch, or ring, the way it works is it holds your hormones up for 3 weeks or more. And then when you drop it, that's when you have that artificially induced withdrawal bleed. If you go beyond 5 days off of the pill, there's been known escape ovulation, which means the egg could pop out. And if the egg pops out, then it could meet sperm, and then you could end up pregnant. And so in any time you're trying to prevent pregnancy, if you've been on the medication for a week in a row, or I like a week in a row, then you're pretty much protected. But I would say that, in terms of missing a whole bunch of days in a row that you didn't envision was going to happen, you would ideally have 3 weeks of hormone before you miss any, because then you're in that random withdrawal bleed. You can choose to do that whenever you want. And
Gotcha.
then sometimes we have patients and they're like, Dr. Yen, why am I bleeding? And I'm like, what time do you take your pill? Sometimes 8 a.m., sometimes 8 p.m., 8 a.m., 8 p.m. You want to take it within 24 hours every single day. So if you take it 8 p.m. one day, you could take it 8 a.m., but that's within like 12 hours. But if you go 8 a.m. the next day, then you've gone too far because it's more than 24 hours. And then you put yourself at risk. And anytime you put yourself at risk, you could follow up with some emergency contraception. And at Pandia Health, we're proud that we always offer, do you want some emergency contraception with that in case you mess up, or in case, God forbid, one of your friends is sexually assaulted, you're like, here, take some emergency contraception.
For sure. And also it's great that Pandia Health offers that, because I don't know if this is everywhere, but in experiences that I've had with myself and my friends purchasing Plan B from CVS Pharmacy, it's in a container that you have to give to the person at the register, and they have to open it for you. Yes, you can't even do it privately. So yeah, I would totally recommend getting it delivered and just having it just in case, because yeah, you never know when that's going to happen, and you don't want to deal with that embarrassment. It shouldn't be embarrassing because it happens, but we shouldn't.
And you're actually being responsible. You're the opposite side. The condom popped, or you forgot, or whatever. And I'm trying to prevent unplanned pregnancy. The other side is, we'll see what happens. And if I end up pregnant, then I'll deal with it. No, let's, prevent. So you should be proud that you're trying to prevent it. The key I want to make sure all the viewers here know is check out our Pandia Health video on emergency contraception, so that there are 4 forms, and that the copper IUD, the prescription emergency contraception, work much better than the over-the-counter Plan B and its generics. And that if you have a body mass index of 26 or greater, Plan B and its generics are as good as if you took a Tic Tac, which is not very good for preventing unplanned pregnancy. So watch our video, but also just ask for prescription emergency contraception. So I forgot to summarize the key points with respect to the Affordable Care Act and SCOTUS potentially reversing the Affordable Care Act. Number 1, if you're thinking about an IUD or implant, run, don't walk, to contact your physician to schedule that. If you're on the pill, patch, ring, ask your doctor for a year's supply. And at Pandia Health, we always write for a year's supply. By law, in 17 states, your insurance is supposed to cover a year's supply. And at Pandia Health, we can deliver to all 50 states. But I would say very few insurance companies are following that law. But what you can do is, 1, if you're not a Pandia Health patient, call your doctor and say, hey, I want a year's supply because I hear the Affordable Care Act might be reversed, and check if you're one of the 17 states, or just do it anyway. And then fill it. And if they don't give you a year's supply, then unfortunately the pharmacy can't do it. You have to call insurance company and say, hey, the law says you're supposed to give me a year's supply. What the hell is your problem? And I'm going to tell my senator and all my elected officials that you are not following the law, or the district attorney, I guess, is the person that you would invoke. And then there's a great organization, National Women's Law Center, has a website, coverher.org. And they have a phone number and an email that you can contact and say, hey, my insurance won't do it despite me calling. And they have scripts that you can yell at your insurance company. And they're probably also collecting the data maybe for a class action suit, hopefully, or something to bring shame to all the companies that aren't following the law. So I would get a year's supply now before the Affordable Care Act can be reversed, or before January, which might be the earliest that they might rule on it. And then even then, we don't know if it would wait until the next time your insurance, renewed. And then third is that even if they reverse the Affordable Care Act, nothing stops the insurance company from continuing to provide it with no copay, no deductible. And that's where you yell, it's fiscally smart and morally right to cover birth control. But more, the numbers speak for themselves. It's about math. And you can tell them Dr. Yen, who went to MIT, knows math. And so the math shows cover the birth control rather than later.
Yes, someone Kim just said, insurance is always such a pain. It really is. I am under 26, so I'm actually still on my parents' insurance, which is so nice. But of course, that doesn't last forever. So I'm trying to learn a little bit about how it works now so that I'm not confused in the future. But you're so right. It is a pain. But as Dr. Yen says, yeah, don't be afraid to go yell at them because it's not right to do that.
It's your right. It's a law that's been passed. You paid for the insurance. You should get your stuff covered. And then you bringing up the 26, that is part of the Affordable Care Act. They mandated that people under the age of 26 stay on their parents' insurance. If they reverse the Affordable Care Act, gone. The other huge part of the Affordable Care Act is that it blocks insurances from refusing to cover you if you have a pre-existing condition. And I think also from jacking up your prices if you have a pre-existing condition. And sometimes they count pregnancy as a pre-existing condition. They definitely count depression, asthma, polycystic ovarian syndrome, endometriosis, bad, evil, heavy periods, anemia. Any health condition is a pre-existing condition. And they can either jack up your prices or they can refuse to cover you, which ironically enough, the person that needs health insurance is the person who has a health issue, right?
Yeah, after that list, who doesn't have pre-existing conditions?
Exactly.
I really can't think of anyone, to be honest.
Newborn, maybe. But even a newborn can have stuff.
For sure, yeah. It's crazy. Okay, let's see. So if anyone has any more questions, feel free to comment them down below. But before we go, do you have any last takeaways? I know you kind of just summed everything up, but any last words of advice from the doctor? I always like to ask that to my healthcare providers.
I think that's great. I think it's, get your birth control, try to get a year's supply if relevant in your state, and get prescription emergency contraception. I usually dispense one refill times 11 for my patients, and the prescription works better than the over-the-counter. And right now with the Affordable Care Act in place, no copay, no deductible. Whereas if you walk into a pharmacy right now and you ask for Plan B, could be $60. If you ask for generic, it might be $20, but it might be $40 depending what the pharmacy wants to charge. At Pandia Health, we charge the lowest price possible.
Yes. Yay. We love it. Oh,
thank you.
Yes. Very informative. Yes. Thank you all so much. And thank you, Dr. Yen. This was really great. Honestly, I learned a lot, so I'm very happy about that. And for everyone watching, don't forget to check out pandiahealth.com for not only FAQs, fun blogs. We have a YouTube channel with like fun self-care tips. And of course, if you are interested in the free delivery of birth control, definitely check that website out as well. Other than that, have a wonderful night, and we hope to see you on our next live. I believe our next live is this Thursday. It's a family planning workshop with Sabrina Perez. Very exciting. I will be on that one as well. So kind of going off of this. Yeah.
And then tomorrow we're doing something with Girlology on their Facebook Live. If anybody has younger people, and we'll be talking about #periodsoptional. So tomorrow at 5 o'clock Pacific, 8 p.m. Eastern on Girlology. And hopefully we'll co-stream it on ours. But if not, go to Girlology.
Girlology. Perfect. Awesome. Well, thank you so much. And thank you to everyone who watched. We really appreciate it. And yeah, I hope you all have a wonderful rest of the evening.
Thanks, Seismic Sisters. Thanks,
Yes.
Dr. White Carey, and all of our amazing patient care advisors and social media team. I see Daisy got on as well.
Oh, yes. Yeah, thank you all. I hope to meet you in person or maybe just virtually sometime soon. Have a great night.